Hi guys, Dr. Brodsky here. It's finally here, your third trimester. You can start counting down. The third trimester is 28 weeks until you deliver. You can expect at this time to be feeling more and more pressure. This is when your baby is going to do the majority of their growth. So by 32 weeks, they're going to start gaining about ½ pound a week. So that's important. You're going to start feeling lots more pressure in your pelvis. This is when a support band is also helpful. You may notice that you have even more urinary frequency, even more low back pain, and some sciatic pain as well. So if you have any of those issues, definitely check in with your doctor about that. You're still going to feel good fetal movement, and you may notice some abdominal tightening or some Braxton Hicks contractions occasionally if you overdo it. I usually tell patients if you're stressed out or you're dehydrated or you're on your feet for a long time and your belly gets really tight sometimes, and it doesn't really hurt that bad, it's probably a Braxton Hicks contraction. They're usually irregular and aren't that painful. So just keep an eye on those and make sure you keep your doctor informed as to what you're feeling. You also may notice more vaginal discharge around this time. You may have groin pain, and it may be difficult to cross your legs because your muscles get sore in your upper thighs. All these things are very, very common. What you can expect from your doctor in the third trimester is more intense, frequent monitoring. So they're going to see you every 2 weeks generally, and then the last month of pregnancy, they're going to see you weekly. What they're checking for is to listen to your complaints, check for signs of labor, making sure your water's not leaking or you're not bleeding, and making sure your baby's moving. Usually I tell patients they should move 5 or 10 times every couple of hours. So if you're concerned, go to a quiet room, block out distractions, give your baby an hour to wake up, and if 5 or 10 times doesn't occur, then you want to call your doctor or go to the hospital. The other thing that you can expect in the third trimester is possibly a growth ultrasound. If your doctor's concerned about your baby's growth, then they may do an ultrasound to make sure that the growth is on track. Another thing that we often do is a Group B strep screen. So this is a little culture that's done in the vagina between 35 and 36 weeks. It's also done around the bottom a little bit, and it tests for a very specific type of bacteria that lives on some people's skin. Unless you had this bacteria found earlier on in a urine culture, everyone gets screened for this. If it's present, then you get an antibiotic when you're in labor. If you have any questions about it or you have allergies to medications, make sure you talk to your doctor about that. Once you're 36 weeks, we start seeing you every week. Sometimes doctors will check their patients on a weekly basis. Oftentimes, my patients just cannot help themselves and they want to know what their cervix is dilated to every week. Don't get discouraged. Remember, I always tell people labor is like a freight train. It doesn't matter where you start from, you just go and you go quickly when it happens. So whether you were closed or 1 centimeter for a few weeks, don't worry. The average first-time mom delivers in the 39th or the 40th week. So hang in there, that baby will come, your body will know what to do, but your doctor's there obviously if there's any hiccups along the way. Aside from that, the doctor is going to be checking your blood pressure and making sure that you don't have extra protein in your urine or anything like that. Things you need to look out for are signs of labor, obviously, so frequent contractions, intensely painful, where you're really having to catch your breath and stop talking if you have one. If that type of pain comes every 5 minutes for an hour, that could be labor and you need to go to the hospital. Also, always look out for bleeding, gushes of fluid, and decreased fetal movement. So inform your doctor if you feel like your baby's not moving the same way. Also, you want to look out for a headache or severe vision changes. Make sure you're pre-registered at the hospital, make sure your bag is packed, and make sure that you also know about your doctor's call schedule. Find out what other physicians are in your doctor's call group so you can determine who might be answering and responding to your concerns. Your doctor also probably has a way that he or she does inductions in their practice, so that's something to talk about as well, and also with your partner. That's it, guys, for the third trimester. Happy delivery, happy birthday to your baby. Check out my other videos. Thanks for watching this one. I also do weekly and monthly pregnancy videos. You can also find me on drbrodsky.com.